for me is really that natural products have played such a key role in trying to understand how these nerve fibers work. And probably the best example is given by pungent agents from capsicum peppers or hot chili peppers. And back in the 70s, Jansko and colleagues in Hungary showed that the pungent ingredient in hot chili peppers, namely capsaicin, elicits a sensation of burning pain by serving as a specific chemical activator of these nerve fibers that are involved in pain sensation, namely the nociceptors. And some years later, Bevan, Rang, and others in London carried out some biophysical studies to suggest that what capsaicin does when it interacts with nerve fibers in your mouth or anywhere else in your somatotopic surface is to depolarize the nerve fiber and allow sodium and calcium ions to flow in. And the main questions that were still unresolved by this was, does capsaicin interact with a specific site, a so-called vanilloid site, because capsaicin is a vanilloid compound, like other pungent agents in peppers? Is there a specific receptor for capsaicin? If so, what does it look like? And what might its normal physiologic function be in the body? What role does it serve in our endogenous ability to sense pain? And we, like many other people in the field, realized that identifying or addressing these questions could lead to some key insights into pain sensation, because sensitivity to capsaicin was a major functional hallmark or characteristic of these specific nerve fibers that are involved in pain sensation. As in other sensory systems, one of the great things about doing this, identifying genes and molecules that specify the sensitivity of cells and nerve fibers to stimuli, is that you can use them as molecular probes to try and understand the cellular and circuit logic as to how this information is conveyed to the nervous system and ultimately to your brain, so that you can discriminate different percepts, in this case heat from cold. And what these markers, antibodies to these channels, now tell us is that the cold and hot receptors are really segregated. They're expressed by distinct subpopulations of sensory nerve fibers, which tells us, at least at the outset, that the information as it comes into the spinal cord, at least at the beginning, is segregated. And that information about cold and information about heat is conveyed by two so-called labeled lines, separate lines of sensory nerve fibers. And this at least begins to give us some idea as to how behavioral specificity is dictated by by circuitry within at least the peripheral aspect of the nervous system. So we've used natural products to identify some important players in pain sensation, some of which I haven't had time to tell you about today. And all of this work has really come about through just sort of curiosity-driven research, which, by the way, was funded by you, the taxpayers, the NIH. And we've just been curious about how this system works and allows us to appreciate the world around us. But as so often the case, curiosity-driven research can have very practical and important therapeutic aspects, and all of these channels are now novel targets for the development, hopefully, of new types of analgesic drugs that we can use to treat a variety of peripheral pain syndromes. And that's work that's in progress by a number of pharmaceutical and academic labs. But hopefully, our goal to understand how the system works at a curiosity-based level will also have some practical outcome that will benefit patients who suffer from chronic pain syndrome.